Dr. Jolie Silva here, clinical psychologist. I wanted to talk to you about the diagnosis of agoraphobia, which some of you might have heard of before. You might know people who have been diagnosed with it, but I wanted to just give you a little overview of what agoraphobia actually means. So when you think of agoraphobia, you tend to think of people stuck in the house and not wanting to leave the house, which happens quite often in someone with a diagnosis of agoraphobia. With any diagnosis, firstly, the person's functioning needs to be impaired in order to have a diagnosis. And what that means is that they're not able to function optimally in school, work, socially. There is some level of impairment, a significant level of impairment in some area of functioning. So that's the first thing. And that goes with all mental health diagnoses. But specifically with agoraphobia, a person who has agoraphobia has an intense fear of going into any situation, usually outside of their home. And the fear is of experiencing some kind of panic-like symptoms or something else that where they would be extremely embarrassed, or fear of experiencing a high level of anxiety in front of other people where they can't escape. And that's usually what it's about. It's usually about a fear of experiencing anxiety or embarrassment or shame or something like that in front of other people where you can't escape is usually where it is. And some of those places might be waiting online at a store, or open spaces like concert halls, or public transportation is a big one. If you don't want to get on a train because there's no way to escape, or an airplane, you can't get off if you were to have a panic-like symptom. So then what happens many times is people with agoraphobia wind up not wanting to do these things unless they're in the company of somebody else. So they have like a companion, where the anxiety goes down a little bit if they have this we call safety person with them, or they just endure these types of situations with a very, very high level of anxiety. So what winds up happening is, if you're feeling that uncomfortable going out into a situation, you wind up just not going. And then your world becomes smaller and smaller and smaller. I'm not going to go there. It's just too anxiety provoking for me. And I'm not going to go to the store, and I'm not going to go to that party, and I'm not going to go to this, and and all of a sudden your world becomes tiny, because it becomes just your house, or just your bedroom, or you have a safe zone and you have your safe people. So, and look, it progressively gets that way. So if it's gotten that way, yes, the first recommendation I would have would be to call a mental health professional to seek treatment for it, which would be exposure and response prevention, a type of behavior therapy, or a cognitive behavior therapy. Or even if it's starting to get there, right? You start seeing your loved one, or you notice within yourself, you have some signs that you're getting to that place where, like, I don't want to go to well, now we're in the middle of a pandemic, so there are no baseball games. And just a side note, being in the COVID pandemic, people with agoraphobia, we pretty much are all in the house right now. So that just poses another challenge to the treatment of agoraphobia, because normally the treatment of this would be to encourage people to go out. Now we're in the middle of a global pandemic where we're being told not to leave the house. The treatment of agoraphobia, from my standpoint, from a mental health standpoint, not from a pharmacology standpoint, which would be medication, right? But my standpoint would be, with or without medication, we're going to do therapy. And one of the empirically based treatment for agoraphobia is something called exposure and response prevention. I just threw out a lot of psychological jargon there, so let me just break it down for you. The way to treat agoraphobia, which is when somebody does not leave the house because they're anxious, is a therapy called exposure and response prevention. Let's just call it ERP. And what that is, a very brief overview, is the reason anxiety disorders develop is because people avoid what causes them anxiety. So just let that settle in for a second, okay? The reason anxiety disorders develop is because people continue to avoid this thing that they think is causing the anxiety. That's a very simplified version of it. Okay? So, to treat agoraphobia, we have to have people, we face their fears. Okay? That's something like you've probably heard your whole life, but that's really what it is. A little more technical than that. But so we want to encourage people as therapists to gradually start going into these situations that are fear inducing. And we do that with different kinds of techniques. That's what ERP is. It's facing your fears gradually under the guidance of a mental health practitioner who is trained in ERP. How in the world are we supposed to have people with agoraphobia going out into public places during a global pandemic? I'm a little bit stuck on this. I don't have the answers. I think sticking with your mental health professional while this is going on is key, because you can be creative. You can still FaceTime people. You could still go for a walk outside. You could still get out of the house. You could still go to a grocery store. So you can still do certain things. But ultimately, the pandemic is in some way reinforcing or enabling agoraphobia, because all of us are in the house. So it does give us a bigger challenge, a huge barrier in the treatment of it. And then what agoraphobia can lead to is social isolation, which can also lead to depression and other things. So that's why people are talking about a mental health crisis going on right now. These are some of the reasons why. So again, as I always recommend, if you had or have agoraphobia or know anybody who has symptoms of agoraphobia, then you reach out to a mental health professional. And even though we're challenged right now with the treatment of such a disorder, we can still make some progress toward it. So if you have any questions, feel free to visit any of the websites or comment in a comment section, or like or subscribe to any of the channels. Thank you so much and take care.